Thank you so much for being here, and we're so excited to be hosting the second session of our Climate, Health, and Healthcare speaker series. And today we have a really exciting session, and we're going to talk about the impact of climate change on the delivery of care. And we have three great speakers today, Fiona Hanley, Celia, Culley, and Colleen O'Connell.
So for how tonight's going to work, we're going to have each speaker give their talk for about 15 minutes each, and then at the end we'll take questions. So please feel free to type in your questions in the Q&A box, and we'll make sure to ask it during the question period at the end.
And just as a reminder, if you attend 4 out of 6 sessions and you do write a short reflection at the end of the speaker series, you are eligible to receive a certificate. So keep an eye out for more details on that.
So we're going to get started, and as we mentioned, we have 3 wonderful speakers tonight. So we're going to get started with Fiona Hanley. So Fiona Hanley is a nurse educator and longtime advocate for amplifying the voice and role of nursing leadership in upstream and downstream solutions to the planetary health crisis. She is a board member of Canadian Association of Nurses for the Environment, part of the Canadian Nurses Association's CNA network of nursing specialties. Welcome, Fiona, and I'm going to stop sharing, and then you can begin whenever you're ready.
Okay, so I'm just going to see if I can, oops. Okay, are you able to see my screen?
Yep, looks good.
My slide, okay. Thank you so much. Okay, well, thank you so much for inviting me to speak with you today. I'm really happy to be part of this really wonderful series organized through Cascades. And so I'm just going to talk a little bit about some of the health impacts of climate change related to illness now and in the future. Just a very quick review of some of the latest findings from the IPCC, because I know that a lot of the issues were covered in the previous session. A short description of some of the patient populations at higher risk, and then what role nurses can have in addressing these impacts. So climate change, of course, is our new reality. It is caused by humans. We are seeing effects in Canada and around the world on human and planetary health. Climate change intensifies inequities. I think that's a very important point to make. And leadership from health professionals and health systems is crucial. It's very important to take action now in order to secure our future. I would say that climate change alongside the collapse of biodiversity have been called the biggest global health threats of the 21st century. Climate change affects the social and environmental determinants of health, so our access to clean water, to safe drinking, to clean air, to sufficient food and secure shelter. And these crises are very much interlinked, both caused by human activity that has disrupted the Earth systems to the point of multi-system failure. And those are some of the consequences that we are seeing now. The IPCC, the most recent report, the 6th report on climate, 2 of the working groups have reported so far their findings on this, and there'll be a 3rd report that will be released in April this year. And so this is the latest and most up-to-date knowledge on the state of the climate, both globally and regionally. And this most recent report has called this a code red for humanity. So there are recent changes in climate that are widespread, rapid, intensifying, and unprecedented in thousands of years. Beyond 2040, I'm sorry, because I can't really see my slide. I'm just going to just diminish that somewhat. Beyond 2040, and depending on the level of global warming, climate change will lead to numerous risks to natural and human systems. That is stated with very high confidence from the report. And really that this time the report has used the strongest language than ever, that the scientific evidence is absolutely unequivocal. that climate change is a current and future threat to human well-being and planetary health. And there's an urgent need for concerted anticipatory global action on both adaptation and mitigation. And if this is not done, there's only a very brief and what is called a rapidly closing window of opportunity in order to be able to secure a livable and sustainable future for all. So I think these are very alarming messages from the IPCC report that we really need to pay attention to. We have seen that impacts are already widespread at the global level, which is estimated to be at around about 1.1 degrees centigrade above pre-industrial levels. So that's estimated from around about the mid-19th century. We are already approaching the Paris Agreement limit of less than 2 degrees, and as they specified, preferably less than 1.5 degrees. Some reports are saying that it's almost inevitable that we're going to get to that point to 1.5 degrees within the next few decades. Changes are being observed across every region, across the whole climate system. Greenhouse gas emissions continue to increase globally, and everyone today will have to adapt to a warming climate. This is an image of some of the flooding that we had in Quebec a couple of years ago when there was flooding in Ontario, in Quebec, and to the Maritimes as well too. So this is some of the houses that were flooded at that time as well too. Climate change has been a driver of recent health effects related to rising temperatures, extreme heat, wildfires, and expansion of zoonotic diseases into Canada. And adaptation and reduction of greenhouse gases that are both planned and executed by the broader community can help protect people from impacts in the future. And so health professionals certainly need to be at the heart of that as well too. So some of the consequences that we are seeing as per all of these reports, the IPCC report, for example, talks about extreme heat, extreme weather, so extreme weather events, air pollution, wildfires and wildfire smoke. Because it's not just the fires itself as well too, it's the smoke that also has a very important health effect on people. Melting permafrost, sea level rise, floods, ecosystem changes, and biodiversity loss. So in terms of health impacts on populations, climate change affects everybody. It's been a driver of multiple recent health effects related to rising temperatures and extreme heat, wildfires, like I said, expansion of zoonotic diseases into Canada, such as Lyme disease, West Nile virus, and so forth. And Canadians are exposed to both direct effects, so heat and extreme weather, and also indirect effects, such as infectious diseases, food and water contamination, but also a loss of income, loss of livelihood, and other important socioeconomic effects that result from these climatic effects. And of course, northern communities, Indigenous communities particularly, are high risk from melting permafrost, loss of traditional hunting grounds and food sources that exacerbate pre-existing health and socioeconomic inequalities that are associated with colonialism and systemic environmental racism. So we've seen floods in Quebec and the Maritimes, forest fires in BC, northern Alberta, droughts in the prairies, and all of these have significant effects on Canadians in terms of their physical and mental health, the livelihood of Canadians, the sense of belonging, the ability to plan lives now and in the future. And so that's just a list here of some of these different health effects that we're seeing. And of course, as mentioned last week, healthcare services themselves are also being impacted as well too. The provision of care to people often at these very crucial times when they might not have access to much needed healthcare services. The Lancet Countdown report of 2021 gave 44 indicators describing continued increase in the health impacts of climate change and ongoing health consequences of delayed and uneven responses from around the world. And global damage is in so many parts of the world, affecting those least equipped to adapt to the consequences. And so multiple inequities in who are most affected by heat, by floods, by disease, by water and food insecurity, and stark consequences to those who have contributed least to the pandemic. So to the problem, excuse me. It was really made very crystal clear in both the Lancet and the recent IPCC report of 2021 and 2022 of these growing inequities, and that the most vulnerable regions are cited as the Global South, who are at highest risk. So these are regions that are already heavily burdened with multiple challenges of high levels of poverty, inadequate access to basic services already, like water and sanitation, gender inequities, and poor governance. And there's an estimated 3.3 billion people who live in countries that are seen as very vulnerable, compared with 1.8 in low or very low risk countries. And so populations in these very high risk or high risk countries is projected also to increase substantially. So when we think about climate action, the focus really has to be on climate justice because of the interconnections between inequity and climate impacts. And it's also clear that climate justice has to be central to local, regional, national, and global policies. So I also wanted to mention as well too that climate change also contributes to, it builds on top of inequities faced by many people and contributes to violence faced by women and conditions that women are already facing. So ongoing gender discrimination, harmful gender norms, especially in low and middle income countries, results in increased vulnerability of adolescent girls who are living in poverty, who are often subject to the least visible impacts of climate change. So I'll talk a bit more about that afterwards as well too. So looking at some of these, the other populations who are at particular high risk, Indigenous peoples face additional vulnerabilities due to climate change because, as I've mentioned, there are already existing poverty, discrimination, and connection as well to local ecosystems. So there are multiple and profound effects on health and well-being that will exacerbate already existing health and socioeconomic inequities experienced by First Nations, Inuit, and Métis. Including respiratory, cardiovascular, water and foodborne, chronic and infectious diseases, as well as financial hardship, food insecurity, and that may result in evacuations from traditional territories due to extreme or unpredictable weather conditions. So it should also be remembered that the North is warming much faster than elsewhere, and so limiting the melting of the sea ice, the melting of the permafrost, limits mobility and ability to hunt traditional foods, but also is it's a loss in terms of the identity because of the very close linkages to land and sea. And the other thing that we might think about as well too is increases in food prices that often are already very high in northern regions, and those are projected to increase even more. The older or frail adults can also be at higher risk from climate impacts for a number of different reasons, physical, financial, social, and emotional. We already saw the huge impact of COVID on the elderly population, already at high risk and in care that was unable to adapt to the sudden crisis of the pandemic. Older adults are more vulnerable to a range of health problems that are associated with normal changes in age, so decreasing strength and impeded mobility, so things like muscle and bone loss, for example. And in many events, such as the Hurricane Katrina or the heat dome in British Columbia, there were much higher rates of deaths in people over 75 years old. And so in terms of health conditions, elderly people might have more difficulty in thermoregulation, in adapting to heat or cold, and certain medications can affect their responses to heat or cold. Or contribute to their exacerbation of dehydration, for example. They also have the higher likelihood of one or more chronic conditions such as heart disease, diabetes, COPD, that might contribute to their susceptibility. Elderly people are often living alone or are isolated with few social contacts. Nearly a quarter of Canadian seniors live alone with few or no family or friends. And sometimes there are income issues, so they might be deprived of having the use of medical devices, dialysis machines, CPAP, or when there are electricity cuts, or cut them off from use of the telephone, for example. And as I mentioned, in the heat waves of BC last summer, that of Quebec in 2018, seniors were made up the vast majority of people who died in those excessive heat waves. Children and youth, the 2021 Lancet report stated in no uncertain terms that climate change will define health for generations, that climate change is already damaging the health of the world's children, and babies born today will face unprecedented health risks and lifelong health consequences from rising temperatures. We know that children are not small adults. Their immune systems, their organs are still developing. They breathe faster, they eat and drink more for their size compared with adults. Their bodies are less able to eliminate toxins, and their developing bodies and immune systems make them more susceptible to environmental exposures and disease. And as their environments are disrupted by climate change, they are growing up in circumstances that threaten their health, their nutrition, their education, their development, survival, and their future. Again, I mentioned something about gender, so I think it is important to talk about gender, which has become increasingly at the forefront and included in efforts for climate mitigation and adaptation. As we know, gender is not an absolute nor universal term, but it does shape expectations, attributes, roles, capabilities, and rights of individuals around the world. So thinking about rights and roles of individuals in a given context, how these roles intersect with diversity, culture, cultural identity, socioeconomic, religious, sexuality, and gender is essential really in working in any work against injustices or promoting human rights and implementing effective policies, including those of climate change. Catherine Wilkinson, if you have read the book, that fantastic book, All We Can Save, has said the climate is a multiplier of any cracks, imbalances, or injustices that are present in current society. It amplifies them. And the climate crisis is not gender neutral in its root causes, which grow out of patriarchy, amongst other things. Its impacts on women and girls are on the back foot in various ways, and extreme weather events are being tied to lack of education, early marriage, sex trafficking, domestic violence, and all of these things that are already present in society that get turned up a notch or two. I know that my time is running short, so I'm just going to mention reproductive health as well too is also something that is an important consideration in thinking about climate change. Because there are, it is known that that fetuses through biomonitoring studies are highly exposed to whatever their mother is exposed to. Climate change heightens risks to women, to pregnant people, to unborn fetuses and babies who have been exposed in utero to climate-related stressors. And these are effects that can persist lifelong and into future generations. So things like air pollution, studies have shown that ultrafine and nanoparticles have found their way into placental tissue. Small fedates or premature babies that often are linked to climate change and to excessive heat. These babies are more vulnerable to lower respiratory infections, diarrheal disease, even brain damage and other kinds of conditions. And a report from the State of Global Air, for example, estimated that in 2019, almost 500,000 infants died in their first month from heat effects related to air pollution exposures. Okay, just quickly to end off, the key role of nurses. Nurses have a long history of responding to health and social concerns, in acting courageously in situations of threat and disaster, and in advocating for the most vulnerable in society. And the very identity of nurses is rooted in compassion, in caring for those who need assistance, in reaching out, in speaking out for those who have no voice, who cannot make themselves heard, in responding to issues of health and illness and human suffering. The climate crisis is the biggest threat ever known to health and well-being. and without urgent transformative action will bring humanity on a path of destruction to all that makes life possible. So nurses everywhere are called on to join with others in recognizing climate as a global health emergency and taking planetary health, preserving planetary health as a duty of care. Nurses are in prime positions of influence in both in direct patient care and education, in healthcare administration, in research, education, public health community organizations, and in politics. So I'm going to end there, and I'm sorry I've gone over my time a little bit as well too. And then my slides, I'm going to see if I can stop my share.
Thank you so much, Fiona, for your talk. That was wonderful. So I'm going to introduce our next speaker today. So we have Celia Culley, who is currently the Clinical Pharmacy Coordinator at Royal Jubilee Hospital in Victoria, BC. She completed her Bachelor of Science in Pharmacy from the University of Saskatchewan and subsequently practiced as a community pharmacist in Northern Saskatchewan. She then moved to BC to complete her hospital pharmacy practice residency and Doctor of Pharmacy. She has been in Victoria at Royal Jubilee since 2013. Her current research relates to metered dose inhaler use and mitigating their climate impacts in hospital settings. From a young age, she's had an interest in the natural environment, likely stemming from her youth growing up in a farm in rural Ontario. Thank you so much, Celia.
Hi, everyone. And can you hear me?
Yes, we can.
Awesome. And you can see my, I'll just see that okay?
That's perfect.
Awesome. All right. So thanks so much for welcoming me to this webinar series. So I'm the second speaker, and I'm going to focus on medication management related to the impact of climate change on the delivery of healthcare, focusing on medication management. So I just want to start by acknowledging I'm on the traditional territory of the Anticholinergic people, and I want to thank them for preserving this territory where we live, work, and play. I have no conflicts to disclose. And by the end of the presentation, move a little box here so I can see my slides. I'm hoping that you will be able to describe how climate change and extreme weather events can impact different populations with respect to medication management, describe how extreme heat can impact absorption of subcutaneous and transdermal medications, and describe at least one strategy, hopefully more, but describe one strategy of how we can educate and or meet the needs of patient populations who could be significantly impacted by climate change. So some of you may have seen these catastrophic pictures from the BC floods last November. It had profound impacts on the movement of goods and also the movement of people. This major highway, the Coquihalla Highway, was completely wiped out in some areas, as you can see, and reopened in January, but only with a temporary fix. And so it is something that is ongoing at this point, that it does impact the flow of goods, and that does include medications and people getting to their pharmacies. So this is one way that that climate change can directly impact our patients. So here are just a few ways that medication access can be impacted by extreme weather events. So the top one that came to mind immediately, it comes to mind, is related to the supply chain disruption. So if medications literally cannot get to where they need to go, whether that's from distribution centers to pharmacies or patients going to pick up their medications, this has profound impacts on people's health. There's also examples of loss of medical facilities, including hospitals, labs, pharmacy facilities in, for instance, Australia during the wildfires, and also other wildfires can literally burn down buildings that impact people's health. Power outages have a number of impacts, of course, but related to medications could impact refrigerated medications that rely on refrigerated temperatures to maintain their stability. And also power outages can affect clinical and medication dispensing information systems, which are critical for communicating to healthcare practitioners. As already mentioned, patients may not be able to attend a pharmacy or medical facility due to road closures. And when I was reflecting on who might be the most impacted it likely could be the people who don't generally have a supply of their medications at home. And these could be patients who are home care, who have daily dispensed or daily administered medications, as well as daily witness ingestion or directly observed therapies. And that can be related to opioid agonist therapies, tuberculosis therapies. So there are a number of patients that don't have a supply of medications on hand and rely on infrastructure to get their medications on a daily basis. So the heat dome that occurred last summer, it was already mentioned, nearly 600 people died. That's the current calculations due to this extreme weather event last June and July. And many of these deaths may have been preventable. So with hyperthermia, this is a severe life-threatening illness. And as we can see, we did see that death toll and other health impacts related to this historic heat. As many of you may know, body temperature regulation relates to heat production balanced with heat loss. And there are a number of medications that can impact heat regulation. So there are medications that can increase heat production. There are medications that can increase metabolic rate that therefore affect heat production. But I'm going to focus on impaired heat dissipation because this is probably potentially the most clinically significant related to a large number of patients, given the large number of medications that have anticholinergic effects. So I briefly wanted to review the cholinergic or muscarimic receptors. So there's the M1 receptors that predominantly innervate the central nervous system, parietal cells, and salivary glands, generally considered the neural muscarinic receptors. The M2 receptors predominantly innervate the heart, so predominantly related to heart rate. And the M3 innervate the smooth muscle tissue and exocrine glands. So honing in on that M3 receptor, I do want to focus in on the sweat glands. And in fact, there are some agents that focus on this M3 receptor to help patients who have hyperhidrosis, so excessive sweating. We actually use anticholinergics to block these sweat glands to reduce sweating. So as you can imagine, that these medications could actually impact patients when we need sweating to help with that heat loss. So there is a risk of hyperthermia with anticholinergic medications predominantly related to this mechanism, is blocking the M3 receptor. And many of you have probably heard this kind of hot as a hare, blind as a bat, etc. Toxidrome related to anticholinergics. So hot as a hare relating to the anhidrosis, so impaired sweating, leading to temperature elevation. So there's so many medications that have anticholinergic effects. And so I've listed many of them here, but this list is not exhaustive. So just to briefly review, so antihistamines, predominantly the first generation, but other second generation antihistamines as well. Antispasmodic therapies, tricyclic antidepressants, which are fairly commonly prescribed. Paroxetine is the SSRI medication that has the most profound anticholinergic effects. Skeletal muscle relaxants, anti-Parkinson agents, urinary incontinence medications, so specifically oxybutynin, but all of the urinary incontinence medications. And antipsychotics are certainly one of these key groups that I'm going to focus in on. So the phenothiazines, which are the older generation antipsychotics, such as chlorpromazine, is definitely one of the classes medications that has profound anticholinergic effects. And then clozapine is another key medication to be aware of. But this list is not exhaustive. So just to be aware of that. So we know that people with pre-existing mental health conditions are disproportionately affected by climate change, so much so that in 2017, the American Psychiatric Association released a position statement indicating that, acknowledging that there is this increased risk. And there's a number of different factors, and I believe the research is ongoing, but it appears that some mental health conditions themselves, such as schizophrenia and depression, it's a shift in the neurotransmitters. The disease itself can impact temperature regulation. And depending on the severity of the disease, people may be less likely to be aware of their temperature rising. They may not take the necessary precautions, such as removing clothing, drinking adequate fluids, so more related to the disease state itself. But psychiatric medications as well can interfere with the ability to regulate heat. And clozapine in particular, both with its anticholinergic effects as well as its anti-dopaminergic effects, the combination of those two is associated with a higher risk of injury and death during heat extremes. Patients with pre-existing mental health conditions may be more likely to live in poverty or have a concurrent substance use disorder, and that can lead to challenges with coping with changes. As I've already mentioned, maybe less aware or able to take precautions to reduce heat, like the coping strategies that I mentioned, removing clothing, taking a cool bath, seeking out air conditioning, or maybe just not even having access to air conditioning. And then the other thing that I found really interesting is just clinicians not necessarily being aware of that effect of antipsychotics and anticholinergics in terms of hyperthermia. And there was a case report of a patient on clozapine who presented with fever and was kind of being worked up for sepsis, being worked up for neuroleptic malignant syndrome, but then ultimately was diagnosed with heat stroke, was rehydrated, and did very well. And so just having this on our radar, that these medications can have a profound impact on heat regulation, is important for us as clinicians so that we can help our patients. People with pre-existing mental health may be more likely dependent on service infrastructure, medication supply chains. As I already mentioned, may in some of these patients be receiving daily ingestion supports, and so they could be at risk of further disruption in their health related to supply chain or surface disruptions during extreme weather events. So other medications that I wanted to kind of get on your radar now, if it's not already, is that there are many medications that could have increased risk of adverse reactions during extreme heat. So ones that come to mind, not an exhaustive list, though, would be diuretics, SGLT2 inhibitors, which also have diuretic type effects, RAS inhibitors, so the ACE inhibitors, ARBs, the sacubitril valsartan in terms of the angiotensin receptor antagonist with the neprilysin inhibitors. So again, a diuretic effect. If patients become dehydrated, they could be more prone to acute kidney injury, NSAIDs as well. So just being aware that there might be some education pieces and planning that I'm going to provide some tips moving forward. But so certain medications could increase the risk of poor outcomes during extreme heat. It potentially increase benefits, ensuring that patients with respiratory conditions have a supply of their inhalers or respiratory medications prior to wildfire seasons, that they're not waiting till they're down to their last dose to get their refills, just because there could be significant benefit in having these medications readily available. And being aware that extreme heat or freezing temperatures can have an impact on storage and stability of medications. So just on that note, increased temperature can accelerate drug degradation, and there's different reactions that can occur, such as chemical reactions and physical reactions that can lead to drug degradation. And so just being aware that temperatures can have an impact on that, and we need to encourage and educate our patients about proper storage. Liquids, suspensions, and topicals may be more susceptible to those temperature extremes compared to an oral solid tablet, for instance. However, we should try to encourage our patients to not allow medications to be in the direct sun in extreme heat, also not freezing overnight, ideally. There's some limited, I was trying to find studies to say, for sure certain medications, how important stability and storage can be. There's conflicting evidence. So I just was looking up insulin, for instance, and The expiry is based on refrigeration, so that's something to be aware of just in general. And once it's brought to room temperature, it's a 28-day expiry. There are some studies looking at very warm climates, different places in Africa, for instance, that did find a reduction of up to about 15 to 20% of insulin when it was exposed to extreme heat. However, the clinical impacts seem pretty marginal to none. So that was just one study, but just being aware that that education piece, because it could potentially have a clinical impact. In terms of what we're fairly confident can have clinical impact, though, are the pharmacokinetics of certain medications, predominantly transdermal and subcutaneous drug delivery systems during extreme heat. So when a body is exposed to elevated temperatures, our brain reacts and leads to vasodilation in the subcutaneous tissue, leading to increased blood flow to try to increase the heat loss. So with that increased blood flow, however, it can basically lead to increased therapeutic plasma concentrations for these medications. So the range is generally based on a number of pharmacokinetic studies, up to 2.5% or 2.5 times higher. And these were found to be clinically significant. So most of these studies were in like settings of healthy patients being put in saunas and then measuring drug levels. So not exactly analogous, but trying to mimic extreme heat weather. And they found that with nitroglycerin, for instance, statistically and clinically significant drops in blood pressure, increase in headaches, increased concentrations of topical NSAIDs when applied on settings in elevated temperature, and insulin. They did find clinically relevant drop in blood sugars that could be relevant to patients' health. So what can you do? You can educate, you can support patients to be prepared, because we know that when people are more prepared, that can reduce anxiety. We know that climate change, extreme weather events, is associated with mental health exacerbations or new mental health conditions. So trying to help patients be prepared for these extreme weather events, have medications on hand, whether it's respiratory medications or just your chronic medications, just have them available in case there is a road closure and they can't go get the refills. Educating patients on how to properly store their medications, and just being aware of local evacuation plans so that people can be ready should an extreme weather event occur. I do encourage, I believe there are some pharmacy students on the call, and so pharmacists should be aware and be creating an emergency plan for their pharmacy, building relationships with local pharmacies should there be supply chain disruptions, that they can support their patients to go to other pharmacies, and building those relationships earlier rather than later. And also other healthcare professionals linking up with pharmacies in your area, building those relationships so that you can support patients should there be an extreme weather event that impacts medication access, or patients may require education about how to manage their medications. So in terms of some medication-specific instructions, so thinking about antipsychotic medications, providing that education to patients about what to do during extreme heat. So wearing light clothing, drink extra fluids, seek out air conditioning, avoid vigorous exercise, keep out of direct sunlight, and then cooling strategies, cool cloths that you drape around your neck, and taking a cool bath. I think it's also important to clarify ahead of time what patients' social supports are, what their pharmacy supports are, what's their plan should there be an extreme weather event, because they may not have coping strategies to come up with a plan on the fly. So trying to be proactive with patients with particularly severe mental health conditions who are reliant on a number of services. In terms of medication management, it's likely inappropriate to hold or reduce doses during heat, but there might be some scenarios where that might be appropriate. Medications with anticholinergic properties, as I mentioned, there are many, and I think it's always important to regularly assess medications in general, but with this added lens that if an anticholinergic med is no longer needed, or maybe a lower dose, having that plan to taper down or discontinue if that's clinically appropriate, or maybe during periods of extreme heat, you can be proactive and give patients instructions to half their dose. Again, clinically dependent, but trying to be proactive. Same with diuretics, SGLT2 inhibitors, RAS inhibitors, NSAIDs. When clinically appropriate, having a plan to maybe dose reduce during extreme heat. And then in terms of transdermal and subcutaneous meds, educating patients that there can be an increased effect or adverse drug reaction during extreme heat. So I do want to end on a positive note that, this path to limiting climate change is possible, and placing health at the center of this climate change crisis will yield enormous dividends for the public and the economy. And this is from the Lancet report on planetary health. So thank you very much, and I look forward to some discussion.
Thank you so much, Celia. That was a really interesting talk. I'm sure everyone enjoyed that. I'm going to introduce our final speaker for today, which is Colleen O'Connell. And she is a physical medicine and rehabilitation physician and is the medical and research director of New Brunswick's Provincial Neurorehabilitation Center. She works and advocates internationally to build rehabilitation capacity in disasters and emergencies, including as a member of the World Health Organization's Emergency Medical Teams Initiative. And I think we are ready for you to begin. I'm just going to spotlight you for a second.
All right, can you hear me there? For some reason, my slides won't go back. I don't know if one of you has got control, perhaps.
No, it's not moving.
No, all right. Anyway, that's all right. All right, well, welcome everybody, and thanks very much for Fiona and Cecilia, your great talks. I actually learned quite a bit. You're missing my first couple of slides because I somehow can't get it to go back, so I'm not sure what's happening there. But I wanted to really talk to you more about the issues around a particularly vulnerable group, which is persons with disability, and the impact that extreme weather events and climate change, as well as then those situations of emergency, have on persons with disability, and the things that we can do in terms of preparation, mitigation, and response in order to incorporate a disability inclusive approach to disaster management. We know that persons with a disability are extremely vulnerable, both to the effects of climate-related extreme weather events, and as well, extreme weather events can also then create new persons with disability. This is just an example taken from an organization called Handicap International, now called Humanity and Inclusion, which reported on the impact of Typhoon Kitsana in Vietnam, which affected many individuals who are already living with spinal cord injury, and what it caused. And both of the previous speakers mentioned the vulnerability of particular marginalized groups, and as well with persons with certain medical conditions. However, persons who have a significant mobility impairment and specialized medications and equipment and cares are at high risk because of the lack of, for example, accessible evacuation routes and shelters that might be accessible for persons who use wheeled mobility, as well as loss of specialized types of homes that are made to be accessible, and as well their durable medical equipment. In the majority of the world, persons are living in lower and middle income countries. And in many of those countries, people rely on agricultural activities for their supports. And extreme weather events also then impacts on their ability to provide support for themselves and for their families. So as Fiona mentioned, Katrina really brought to light the severe lack of inclusion of persons who are particularly vulnerable in extreme weather events. She mentioned persons who were older, but also the other group were people who had significant disabilities and particular mobility disabilities and relied on wheeled transport in order to be mobilized. And this was not accounted for, planned for at all in disaster preparation and planning. And there were no accessible buses in order to help evacuate people. There were no accessible ways of getting in or out of some of the shelters. And persons with disability in disproportionate numbers drowned in their homes while awaiting evacuation. We know, and it was beautifully illustrated by Fiona with some of the references as well, but not just climate change, but conflict and climate change, and as well COVID, are the greatest challenges that are presenting the human race as it stands, and as well the health of individuals. This is part of the 2020 report on the global state delivered by the UN Secretary General. And it really is a global issue that we have to mobilize in order to address the impacts and the implications of climate change on persons who are most vulnerable. The UN Declaration of the Rights of Persons with Disability, it's signed by almost every country in the world. There's just a few outstanding countries who haven't signed it. But it very specifically talks about in Article 11 and Article 25 that national governments, countries need to take what they call all necessary measures to ensure that the safety and protection of persons with disabilities in situation of risk, emergency, and natural disasters. And so the programming that we do for persons with disability really matters when it comes to both the preparation and the responses to climate-related health concerns. So as already mentioned, people with disabilities are more vulnerable. But at the same time, these sudden weather-related events, implications of climate change, and those emergencies will increase the number of people who now then experience or sustain a disability because of that event. And therefore, how we manage these emergencies will directly affect people with disabilities. This is what's called the comprehensive emergency management. And I don't want you have to try and read every little box on here, but what I want you to take away from this is that planning around emergencies is not linear. It's not just longitudinal from a disaster or a crisis happens and we respond to it and then we recover from it. It's a continuous cycle, and anyone who has been involved with knowledge implementation or translation activities, it's always plan, study, do, act. The disaster or the emergency management cycle is very similar. It's mitigation and preparation into your response and recovery, which then moves back into mitigation. So we're always evaluating what we do, trying to prevent the crisis from happening, but having being prepared for an appropriate response. So there are some international initiatives that have been undertaken, very specific to look at that mitigation of risk and how we evaluate risk for protecting health of persons with disability in those types of emergency situations. And what's really interesting is this was not very specific to just weather-related events, but this is all emergencies. We tend to think of emergencies as being disasters like an earthquake. But disasters also include things like conflict. They also include drought and heat wave and situations where we have been facing the last couple of years, which is a global pandemic. We really didn't think a lot about pandemic planning until we were actually in the face of a pandemic, but hopefully now we've learned from that and we'll start taking a disability inclusive approach as well to pandemic planning. So just a little illustration of how preparation and planning around climate-related events can occur. Now, Haiti's a country that's in the Caribbean. It's been unfortunately affected by a number of earthquakes in the last few years, one even just recently in August. It's also a place of a lot of political instability with a highly vulnerable population due to being a low-income country with lack of resources, as well as threats of violence. there was a hurricane that was heading to Haiti in 2016, and there was a lot of notice about this because it was hovering off the coast, it was making its way, and you kind of knew when it was going to hit landfall. And we did a small study following it because we're connected with all the persons there who've had spinal cord injury. We have a national network around spinal cord persons that evolved out of the 2010 earthquake. And when we followed up with those patients with our peer mentors on the ground, only about half of them were even aware that there was a hurricane heading towards them. Half of them didn't do anything to prepare. 60% of these spinal cord patients' homes were destroyed. 100% had their homes at least damaged. There were new spinal cord injuries as a result of falling debris. People lost their durable medical equipment like specialized wheelchairs and mattresses. And then there were the secondary health complications of pressure sores, lack of access to food and water, and losing their medications. So, and it's not just in low-income countries. I live in Fredericton, New Brunswick. We used to talk about the 1 in 100 year flood. We're now looking at the 1 in 100 is now an every year 1 in 1 year flood. And it's expected now in the next 40, 50 years that we're going to see a lot more frequent and intense rainfall. Over 50 million people are anticipated to be affected by flooding on an annual basis by the year 2100. And so we really, with this knowledge of what is coming, need to work with our patients on a very practical level about being prepared and personal planning. So I just want to take you through the next couple of minutes around a few strategies around just personal preparedness, and as well introduce you to some of the international initiatives that are ongoing around preparedness and response. So for an individual patient, what we want them to know is what their risks are and to be able to assess what their needs might be in whatever type of climate-related event they might be predisposed to, depending on where you live. For instance, if you're in British Columbia, you're probably thinking about fires. If you live where I live, you're thinking about floods. If you're in the prairies, you might be thinking about tornadoes. So it's those types of things. Make a plan for their safety, have your emergency medical kit, and to educate yourself. There are some do's and don'ts checklists that can help guide patients. There's a nice organization called Nobody Left Behind, and that is kind of stemming from what happened in Katrina. But it goes through things that you should do on a very practical level. An emergency kit, many of you may have already seen these, many of you may already have them at home. If think about it. So the very basics, this is kind of rocket science, but it's access to water, perishable foods, purse, pills, pets, but so that includes your medications, some cash, your emergency plan, as well as a few other things for being able to survive, such as having blankets and stove, basic tools. Now, persons with disability and who have other medical conditions are going to have some very unique needs, so those need to be considered and evaluated. Those include things like what's going to happen and how are you going to manage your service animals? What about if you're someone who lives with the need of having a formal caregiver support? And what is your access going to be with or without them in the case of an emergency? If you have someone who has a speech or a language or communication impairment, how are you going to communicate if you do not have access to that equipment? Think practical things like all of your specialized equipment should be identified, but then also have instructions. Some patients have very complex communication tools, but if you don't know how to use it and you're with a stranger, you need to be able to have some instructions for them. And then there's really unique things like having a patch kit for tires on a wheelchair, for instance, that might have inner tubes. Work gloves, because if you're having to wheel in an area that's been through a sudden onset climate disaster, you might be wheeling through glass and debris and puncturing tires or damaging your hands. So there's lots of very little practical things that people should be following. We encourage our patients to have a personal checklist, not just of their medications, but things about them themselves that a stranger would need to know about them. And so we can work with them as their healthcare professionals to help develop this personal list. And so it's all about being prepared and using those resources that are out there to help an individual be prepared on that individual level. So just in the last minute or two, I just want to introduce you to some of the international initiatives along this line that are happening to be able to help better the international and national societies in responding to a disaster. One of the things is trying to develop a global minimal standard for emergency medical teams in those types of responses. So in disasters, whether they be climate related or sudden onset, often there's this massive surge that's needed in health resources and infrastructure in order to be able to provide support for individuals. So the global community led by the World Health Organization has developed what we call the Emergency Medical Teams Initiative. And this was really in response to the fact that, in these kind of catastrophes, there's a lot of good intentions, but that's not good enough. And you really need to have principle and standards in order to guide the medical response. It needs to be timely, coordinated, predictable, and be able to adapt to the local context. So this is what led to the development of what we call the Blue Book, which is minimal standards for emergency medical teams. So the idea is that the health professionals and the logistic workers, support workers, will follow these standards, and therefore the response can be relied upon and be targeted. The overall vision of the Emergency Medical Teams program is to save lives, preserve health, and to alleviate suffering. And so there are these guidance documents have been coming out. We're working on one right now, very specifically for spinal cord injury. There's one that's being developed for burns. There's one specifically around recommendations of rehabilitation, and as well some guidance on how to do rehabilitation in the context of disasters. And so these standards are ones that can be adopted by both national health systems as well as international, and be able to build that capacity at all levels, because ultimately our goal is really to save lives, preserve health, and alleviate the suffering while taking a disability inclusive approach to our responses to these situations of emergencies. So I'm going to leave it there. That's my 15 minutes.
Thank you so much. That was super interesting. And
I'll stop the share too. So, or did I stop the share already?
Yeah, you're good.
Okay, good.
Just quickly, Celia and Fiona, if you wouldn't mind coming back on, because we'd love to just have a quick discussion. And I think one of the things we want to talk about is, in each of your opinions, what would be the most important takeaway you want learners from your own health profession to know about how climate is changing the way you practice care? And maybe Colleen, you could go first on this one.
Sure. So for us, the most important thing is to have that awareness that climate related things, both as Celia really described well, the heat related impacts, as well as being prepared and and you have to be prepared as an individual. And I think as health providers, we need to be able to help our patients ensure that they know what things they need to do in order to mitigate and have that preparedness.
Yeah, and thank you, Colleen and Fiona, for your presentations. And I just would add to that, and I really like to focus on preparedness. And that's preparedness for our patients, and that's preparedness for us as healthcare providers. So both we need to help our patients be prepared, but we also need to prioritize preparedness, because there's always work to be done in that moment. But then if you're in a crisis, it's nice to have that plan in place and those relationships already built with other healthcare providers so we can better support our patients.
Yeah, and I guess to build on both of those, I think, and I really appreciate the two presentations that have been given today as well too. So thank you very much for that too. I think, in terms of my profession and in terms of the nursing profession, there's really plenty of potential to be engaged at multiple levels, and certainly education is fundamental to that. So having the knowledge, building it into curriculum early on, but also then passing on that education. Nurses are very much involved in patient education. It should be part of the assessment, patient assessments. It should be a regular part of that, looking at particular vulnerabilities for patients in terms of all of the things that we've discussed today: mobility issues, pharmaceuticals, living circumstances, a stage of life, etc. as well too. So in planning for discharge, in patient education, in advocating for with policies, whether it's in a healthcare system, whether it's in a municipality, advocating for public transport, for safe mobility, for accessible services, for cooling spaces and clean air spaces. There are multiple efforts that are potential that is still largely untapped at this time.
Thank you all so much for being here today and giving 3 really wonderful and unique talks. I know Fiona and I were talking, it's something we don't get in our curriculum at all, so it was really, really interesting, and I'm sure everybody on the call learned a lot. So I think in the interest of time, we're going to wrap up there, but Fiona and I just want to also thank everyone who participated today and came to our seminar series. We are really grateful to have you all here, so thank you so much.
Thanks, Emma. Thanks, Fiona.
Thank you so
Thank
much.
you all.
Thank
Thank
you,
you.
Thank you, Celia. Bye-bye.
Bye, everyone.